So I'm going to start out with 4 brief cases, and I want you to pay attention to some of the similarities between the cases and then also some of the differences, especially when you get to case 4 compared to the first 3 cases. So we're going to start off with a 52-year-old woman who develops a new rash on the legs. I'll show you a picture on the next slide. And they're tender, painful nodules. Some of them have opened up and caused ulcers in the past. Also with weight loss, joint pain and swelling, no abdominal symptoms, and then starts developing sharp shooting pain, first in the right arm, weakness of the right wrist. And here's a picture of the rash, so you can see this kind of lacy pattern that looks like it's vascular in nature. Some of those areas are actually nodules as well. And then what we would call a wrist drop, so inability to raise the wrist and weakness of that right wrist. So on evaluation, there's findings of inflammation. There's anemia, there's an elevated white count, platelet count, normal kidney liver function, high markers of inflammation, positive testing for hepatitis B. So in this case, a skin biopsy was obtained, which showed vasculitis of the medium blood vessels. And this is a diagnosis of polyarteritis nodosa. So here's another person, 63-year-old woman, untreated hepatitis C, so a different infection. And again, 3-month history of fevers, weight loss, loss of appetite, joint muscle aches, and then numbness, tingling, hands and feet, sharp shooting pain in the right foot. All of this happens over a matter of weeks, the nerve symptoms. And then comes in for this. Okay, so as you can see, very decreased circulation to the fingertips. This is an emergency. And on testing, we see blood counts are normal, high markers of inflammation. A cryocrit test, so that's a protein that precipitates out in the cold that can cause vasculitis. That's high titer, positive. Low complements, which are markers of the immune system that show activity of the immune system, especially in this form of vasculitis, and a very high viral load from hepatitis C. So here the diagnosis is cryoglobulonemic vasculitis. We don't need a biopsy or anything. The clinical findings and the laboratory findings all fit. So moving on to case 3, 45-year-old man, chronic sinus symptoms, which have been going on for years, nasal polyps, then starts to develop some asthma, then starts to have muscle ache, joint ache, and then starts to have nerve symptoms. So shooting pain, and then it's just kind of marching along, weakness from one limb to the next to the next. And here, elevated white count, but most of the counts are eosinophils. The markers of inflammation high again, normal kidney liver panel, and here positive ANCA, which is one of our other markers for vasculitis. We did do an EMG, which showed involvement of multiple nerves, both the sensory and motor components, which we'll talk about. And here the diagnosis was Church-Strauss or EGPA. So moving on to the 4th case, which is different, as you'll see from the rest. So here it's a 55-year-old previously healthy person, and all they have is nerve symptoms that have been progressive over a few months, both sharp shooting pain, but then also numbness, and nothing else. No fevers, night sweats, joint aches, muscle aches, nothing else, just the nerves. And blood tests, all normal, okay? So no markers for inflammation, no markers for vasculitis. But the EMG, again, shows findings that would be consistent with what we call mononeuritis multiplex. We'll see a picture of that later. So suspicious for vasculitis. And so for this one, a nerve biopsy is performed, which shows a diagnosis of vasculitis and inflammation of the nerve. And here, this is one of our rarer forms of vasculitis where it's just in the nerves. So there's nothing systemic. It's not being driven by other forms of vasculitis that we talked about. This is an isolated form of vasculitis that's only in the nerves. So most of the time, the neurologists are the ones evaluating these patients, but oftentimes we also interface in rheumatology to make sure we're not missing a different diagnosis, and then also for some of the management of the immunosuppression that's used, like we would for other forms of vasculitis.